here we are with the gross structures of the spinal cord. And this tends to be very simple because there's not too many structures that can be kind of clearly identified, or just that there's just not. So let's of course get oriented, of course, as at the beginning. So up here is the brain, so this is the most superior aspect. Down here would be the most inferior aspect. This part up here that I'm touching would be the anterior side. Behind this would be the posterior side. First things first, we kind of see the length of the spinal cord is run by the anterior median fissure, this little crack that races all the way straight down. But one of the other things that we see is that the spinal cord is not like consistently thick all the way across. You get two thickenings or enlargements here and down here. This would be the cervical enlargement. You can see it gives innervation to the upper extremity. And then the lumbosacral enlargement, which gives, of course, the branches of the lumbar plexus and the sacral plexus. So those are going to innervate our lower extremities. So that's the first two things that we see, the cervical enlargement and then the lumbosacral enlargement. And then, of course, right at the end, you see the spinal cord actually end, strangely, at L1, right around L1. If this is, of course, T12 because of the ribs, and then you get L1 right at the end. It ends like a cone, and the cone is called the conus medullaris, or also known as the medullary cone. So conus medullaris or medullary cone, both are acceptable. But yet off of that comes off this tiny little itty bitty strip that comes off. Well, this is the filum terminale. It's actually pia mater. I always think of my sister and grabbing her foot with her sock on and pulling her sock off, and then it's just the sock still attached to her foot. And that's what the filum terminale is, just pia mater, this like stretched all the way. It acts like an anchor. It goes all the way to the coccyx, gets anchored down so that the spinal cord doesn't bounce around too much. But if the spinal cord ends at L1, of course you have to have innervation below that. You can kind of see all this. So how do we do that if the spinal cord ends here? Well, we get this large collection of rootlets, anterior and posterior rootlets, and this is what we call the cauda equina. Literally translated as the tail of the horse. Cauda, tail, and equina, horse. But don't call it that. Don't call it the horse's tail. Call it the cauda equina. So this is the collection of rootlets here. And so let's go through again. This would be the cervical enlargement. This would be the lumbosacral enlargement. This would be the anterior median fissure, crack all the way straight down. This would be the conus medullaris at the end. This would be the filum terminale that comes off of that, made out of pia mater, anchoring itself to the coccyx. And then all these rootlets is the cauda equina.